Halo, Assalamualaikum. Selamat datang kembali di channel saya. Sekarang saya kembali berada di kantornya Profesor Dari seperti yang sudah dijelaskan di video-video sebelumnya terkait dengan rehabilitasi dan COVID-19. Sekarang saya akan membahas tentang hal lain. Jangan khawatir, nanti akan ada subtitle bahasa Indonesia-nya. Ya, Profesor Dari, thank you very much again for your time. Now I would really like to ask you about what do you think about the Indonesian traditional medicine? I now bring something, because I have seen in this department, especially Professor Fing, he did a lot of maybe alternative medicine, I can say, because he sometimes use leech, lintah, and then cupping and also acupuncture treatment is also available here. Now I would like to show you one of Indonesian traditional medicine. I think I've never seen in other country, or maybe in China available, I do not know, but this in Indonesia quite common and popular. I do not know what the disease name in English, but some people say literally, usually we treat people because of the masuk angin. This is the name of the disease or maybe the syndrome. Literally in English, enter wind, masuk angin. But many physicians said it is common cold. Yeah. Now the treatment is, I bring this one, some oil like this. Maybe you can try to smell it. Or sometimes also now people can use this one. This eucalyptus oil.
Yes, yeah.
And then we have this one, coin. What do you think with this one and the oil can be done?
Well, to be honest, I do not have any knowledge about traditional Indonesian medicine. So what I can say is only from the understanding, let's say, about traditional medicine approaches. And if you allow me, before we come to this one, let's think a little bit about the more general view on traditional medicines in different countries. Because we have in many countries traditional medicine. There's traditional Chinese medicine, the Ayurveda, the traditional Indian medicine, but we also have in Germany a kind of traditional medicine which is not as old as the Asian traditional medicines. This maybe around 200 years tradition, but it's also a tradition. And what I see, and I come back to this, sorry saying that, what I see is that there are some similarities, which is not the specific interventions. They are very different, very much different. But from the principles behind, we can see some similarities. And maybe they are important. So for one hand, and I think this is also important, we see treatments that are stimuli to the body, especially to the skin. We have the heat and cold in the German method, we have the acupuncture in the Chinese, and others. So stimulation of the skin is very often part of it. The second one is, which is very often included, is movements. It's different types of movement, could be more the training, but could be also relaxing movements. So the movement system is another one, which is very important there. Then in many of these treatments, we have herbal devices, no, it's not devices, herbal substances or other substances we use. We also have this in the German tradition, it's a Chinese tradition. We have a fourth aspect, which is the massage, the mechanical treatment of skin, of muscles, and other structures. And the number 5 is related to meaningfulness.
What does it mean?
What does it mean? That's the question. Or even spirituality, to find a meaning in your life to come back to the sense. It's somewise related also to relaxation, but not only, but to see, for instance, for the German medicine, what is your life goal? How can you balance between activity and resting? How can you balance between sleep and wakefulness? And all these kinds is, of course, in a diverse way in many of these things. So we have, from my point of view, 5 principles that are in there. And I must add, sorry to take your time with this one, what we see from more or less from all these kind of interventions, that they induce reactions of the body, which is a reaction to the disease or an adaptation to improve regulation. So all of our body functions are regulated, and the quality of regulation can be induced. And that's my view. Let's say like that, to the traditional medicines or the medicines that are closely to natural sources, that they may induce regulation of the body. And if we have this principle, then we can have another look at these kind of interventions, and then they make sense also in strengthening health and regulation, not only fighting disease.
Yeah, okay, I get it.
Yeah. That's, I think, a main principle.
Yes.
So coming back to this one, this is, of course, a herbal substance that can be seen in maybe herbal pharmacology or however you do it. And of course, that these kind of oils can influence the nasal mucosa and others, but maybe also some other functions than, for instance, smelling functions.
Yes. This also a little bit warm when applied to the skin.
Yes.
So the heat and cold function is also
yes. So for instance, increasing blood flow is also a substance for the nose mucosa to induce the defense mechanism of the mucosa. So I think for this one, my feeling is that this really makes sense in the class of herbal substances that can help the body, for instance, to defend against bacteria, viruses, maybe also. We don't know exactly, but this is a stimulation of defense mechanism of the nose. So this is,
because
I think,
it is common cold, so it is really relevant for the nose.
This is, of course, this is very, very relevant. Another thing is, we are talking a lot about COVID these days and these weeks and these months. And we know that for COVID, one of the symptoms is the anosmia, so that people cannot smell and cannot taste. And what we do in Germany for that, we have training of the smell function with some oil substances.
Yes.
So we also have eucalyptus in this and maybe others. So this is maybe a new use of the traditional one also for the COVID patients.
So it comes back to the nature, let's say, like this. Yes. But now, because you already see this one, the eucalyptus oil, minyak kayu putih, and now I also bring this one, the coin. Do you have any idea when these are combined?
No. To be honest, I do not have. The question is if you can tell me a little bit about what could a coin mean in Indonesian culture. In German culture, we always think it is to earn money.
Okay, actually,
and maybe this is not deep enough.
This is no, it is actually we do not have deep meaning as far as I know, but I do not know the ancient Indonesian. Maybe they knew more, but because we will apply this oil, for example, to the skin, mostly to the back, and then we will scrub the skin, and then we will see the figure like this.
Yes.
See here.
Yeah.
See.
Yes.
Like this.
Yes.
So mostly for people with have enterwind, masuk angin, or common cold. I have been done also this type of treatment by my mother, I think, long time ago. I think maximum I got around 5 times treatment. Yeah. So what do you think?
Yeah, but this is very clear for me that this is a scratching tool. Yes, I understand this. And hopefully you will show such pictures also to our audience. But this is exactly what I said in my first introduction. This is a stress or stimulation for the skin. And what is happening in the skin blood flow is increasing. You have reflexes to influence also pain perception, for instance. This is from the skin. You can also influence respiratory function. We know this, that there are reflexes. And we said you use it 5 times. This is, for me, a very clear hint that you do not aim at the direct effect, but on adaptation in the kind of long-term effects. Because we know that if you do some stimulation repeatedly, maybe once a day or twice a week or something like that, then the regulation can improve. So this is, from the application, a very clear hint that it may work like that.
Maybe I need to clarify. Actually, 5 times is all of my life. So only I apply once when I get this common cold once, and then the next day it was cured. It really works, because when I get this one, for example, I really difficult feeling nausea, and then when I move a little bit, it is also not good, and then I was stretched like that. The next day it was really.
Well, could be then it's more reflex mechanism if it's like that. But we also could think about, if you do such kind of treatment repeatedly, maybe the risk of getting cold or lung disease could be reduced. We don't know.
But maybe do you know how long does this one is disappear? It takes until 5 days, I think. So it's a long time.
Which is an extremely strong stimulus. And extremely strong. So maybe we have to also think not to overdose. Germans are a little bit less or more sensitive to things. But I really feel that this makes sense in the term of reflexes. But we have to think about what the reaction is. So if we think about this from a scientific point of view, of course, we would measure then respiratory function. We would measure circulatory function. We would maybe even measure immune reaction. Because we know that from heat and cold stimuli, but also from other stimuli, immune function can be stimulated. And we also have to differentiate here immune system. On the one hand, we have the direct defense. This is a mechanism we use if we do the vaccination, the defense for one single virus or bacteria. But we have a so-called non-specific immune response. And the non-specific immune response might be stimulated by this, but it should be measured.
I agree very much. To clarify and confirm what type of immune stimulation will be done for this one.
Interestingly, maybe this is also for fatigue syndrome or something like that.
Could be. Did you try? But, not yet. But to be honest, for some people who never done this one, and then when they try the first time, it will be quite painful and inconvenience. I also had it. But after 2 or the second or the third time, you will be.
But this is also an argument that it could be adaptation, because adaptation also influences the immediate effect and lowers down a little bit. And we also have to say, because in Germany we sometimes have the misunderstanding that these kind of treatments cannot have any side effects. Of course, there can be side effects, and you have to have a good dosage, because if you have a very sensitive person, you maybe should only scratch 2 times and not 15 times.
This is a very important point, because many common people, lay people, maybe they think that any medicine or even herbal without a side effect or toxicity. But actually, the difference between whether it is a drug and toxicant is the dose itself. So we really need to...
but especially focus. Also in these kind of adaptation and training processes, you also can overdose training processes. So you have negative effects. So from this theory of adaptation, it is also so that we can see side effects.
So in the end, I think you as a German professor also can confirm.
This is really worth to do it because from my understanding as a medical doctor, this makes sense. But we need to have a specific understanding that adaptation and stimulation of reactions is very important here, not only to see what's happening locally, but also to see what is the regulation of the whole body. And this is would be very, very interesting, and maybe we even need some international projects on that to apply these principles, because then we can understand better what's happening. So on the other hand, we want to see the effects, but we also want to understand what's happening in the body. That's what I meant, that of course, and this we also can observe in the traditional medicines. This is very much also related to, let's say, the culture of using things, and also the feeling of the body. And this is of course culturally different. And for Germans, we need to be a little bit more careful, because even in acupuncture, some people say, well, you will harm my skin, and so it is very dangerous. Even we know it is not so dangerous, but Germans are maybe a little bit more cautious. And even I had sometimes also Chinese massage. This is much stronger than the German massage. So I think for the German it is good to have it, but less intensive.
Okay, I see. Okay, I think the reaction from this professor from Germany about the Kerokan is finished now. So he also confirmed it can be have a really function, but for the clinically apply in the clinical, maybe we need more study, including the randomized clinical trial in the end. But anyway, see, even he as a professor from Germany also can have a positive reaction to this Kerokan. So
may I keep it?
Yes, please. Thank you very much, Professor Ketermanar. Bye-bye.